Hello, I'm Lanice Smith, a registered nurse and wellness coach, and I enjoy helping women in midlife. I'm a woman in midlife myself, for those of you that don't know me. I enjoy helping women live well, age strong, and just enjoy the best of their life during these midlife years. Today, I'm going to share with you heart disease. Believe it or not, heart disease is overlooked by women more so than you know, and it's the number one killer of women as well. So, stick with me. I'm going to keep it very simple, very practical, so that you can start today taking care of your heart and giving it a little TLC. So let's get started. So why is heart disease in women often overlooked? I can imagine that most of us think of a heart attack, we think of a man clutching his chest with chest pain. But for women, heart disease can look a little different. And so we have many hormonal changes that affect our blood pressure, our cholesterol. It affects the way our body handles stress. And so if you're already juggling a career demands, your family issues, as well as maybe aging parents, or some people are raising their grandchildren, there are many things that cause stress in our body. These things make it easy for us to miss heart disease and even a heart attack sometimes in women in the middle age. So let's talk about some warning signs that women should never ignore, okay? Number one, unusual fatigue. So for example, you're just going about your day as normal, you had a good night's rest, and you're just very, very tired. And so that's unusual. That's some unusual fatigue. Don't ignore that. Number two, shortness of breath, especially when you're walking or climbing stairs. You're just very short of breath. Please don't ignore that. Number three, neck, jaw, or shoulder pain. Because chest pain is not always the symptom when you're having a heart attack or have some heart disease that's causing your heart to work too hard. Could just be pain in this area, here in your neck line, your jaw line, and your shoulder. So keep that in mind. Number four, dizziness or lightheaded. So you know how sometimes if you don't eat, you feel a little dizzy or lightheaded? Well, you have this dizziness or lightheaded despite the fact that you've already eaten. Please don't ignore that. And then the number one thing that tend to get ignored by women is nausea. You may feel nauseated for no apparent reason. You didn't really eat anything that you can think of that makes you nauseous, but you're having these waves of nausea. Please don't overlook that. That's a very big sign that something could be going wrong with your heart. So now that you know the 5 symptoms, they're very simple. Please don't ignore them. Go get checked or speak with your doctor, pick up the phone, call your doctor's office, but don't ignore them. So let me just share some simple tips to help you lower your risk of heart disease. And keep in mind, you don't have to overhaul your life all at one time. Just take it one step at a time. Number one, goes without saying, eat healthier foods. Foods like salmon, leafy greens, berries are all very heart healthy foods. Number two, walk daily. Even if it's 15 or 20 minutes, just get out and walk, relax, take your time, and just build a habit of walking more. And that helps exercise your heart. Number three, manage your stress. I'm gonna take a deep breath and say that again. Manage your stress. You can journal. You can get out in nature when you do your walks. You'll be knocking 2 birds out with 1 stone. You're walking and managing your stress. Therapy. Please manage your stress. There's deep breathing techniques you can do, but just look for ways to manage your stress. And then the last one is be sure to get your blood pressure checked, your cholesterol checked, your blood sugar. You should know these numbers. If someone says, what's your normal blood pressure? You should know that. What's your last cholesterol level? What's your blood sugar normally? You should know these things. These are your numbers. The doctor knows them when they look in your chart, but you should really know them, like your social security number. The last thing I want to say is be sure to advocate for yourself when you're talking with your doctor. If you don't understand something, ask for more of an explanation. Look online and take notes, learn, so that when you go to the doctor, you can ask questions. If you have a friend or family member that's a doctor or nurse, go to them and ask questions, but be sure to advocate for yourself. so that you can get the best care possible for you to keep your heart healthy. Thanks for watching. Be sure to like and subscribe to my channel. Give it a thumbs up. And share it with a friend. You never know who you may be helping. And then subscribe to my channel for more health and wellness tips for women in midlife. See you in the next video, and remember to take care of your beautiful heart.